It is 2 a.m. You are awake. Again, not because of a nightmare, not because of noise, because of that pressure, that familiar, urgent pressure that drags you out of a perfectly good sleep and sends you shuffling to the bathroom in the dark. You go. Maybe a little comes out, maybe a lot, but it doesn't matter, because 40 minutes later, you're back. And then, again, at 4 a.m. And by morning, you haven't really slept at all. You've told yourself it's just getting older. Maybe your wife has started sleeping in the other room because you keep waking her up. Maybe you've stopped drinking water after 6 p.m. Maybe you've started mapping out where every bathroom is before you go anywhere. And here is what nobody has told you. What your doctor may not have had time to explain in that 10-minute appointment. Your bladder is not the problem. I'm going to say that again, because I need it to land. Your bladder is not the problem. And until you understand what is actually happening, nothing you try is going to give you lasting relief. Not the saw palmetto, not cutting out coffee, not waking up at 1 a.m. to pre-empty before the pressure wakes you again. Stay with me, because in the next few minutes, I am going to show you what is really going on. Why the most commonly given advice keeps failing men over 60. And 3 specific exercises you can do, starting tonight, that may help release the real source of the pressure and give your body a chance to rest. My name is Dr. Marcus. I have spent over 20 years in medicine, and I have sat across from more men than I can count. Good men, active men, men who took care of everyone else their whole lives, who came into my office exhausted, embarrassed, and quietly desperate, because nobody had given them a real answer. What I am about to share is not in the pamphlet your urologist handed you, but it should be. Before we go further, drop your age and your city in the comments right now. I read every single one, and I genuinely want to know who is watching today. Let's start with what is actually happening inside your body. Most men over 60 are told they have an enlarged prostate. The medical term is BPH, benign prostatic hyperplasia, which simply means the prostate gland has grown larger than it used to be. Benign means it is not cancer. Hyperplasia just means overgrowth. So we are talking about a gland that has gotten bigger with age. Now, here's where the story gets interesting. The prostate gland sits directly below the bladder, and running right through the middle of it, like a straw through a lemon, is the urethra. That is the tube that carries urine out of your body. So when the prostate grows, it can squeeze that tube. That is why the stream is weak. That is why it takes a moment to start. That is why it feels like the tank never fully empties. So far, so familiar. Most doctors stop the explanation right there, but here's what they don't tell you. The prostate is not the only thing creating that pressure. And in many men, especially men who have been living with this for years, the prostate is not even the main driver of the nighttime waking. The missing piece is your pelvic floor. The pelvic floor is a group of muscles that sits at the base of your pelvis. Imagine a hammock of muscles stretched across the bottom of your torso, holding everything up. Your bladder sits on top of it. Your prostate sits within it. Your urethra passes through it. Now, here is the part that changes everything. When those muscles are chronically tight, which happens in most men over 60, often without any pain or obvious symptoms, they compress the prostate from the outside. They put upward pressure on the bladder. They interfere with the normal signals your body sends about when it actually needs to urinate. Think of it like this. Imagine you have a garden hose. At the end of the hose is a clamp. The water is trying to flow through, but the clamp is squeezing it. You keep adjusting the tap, increasing the pressure, trying different attachments. But the real problem is the clamp. Until you release the clamp, nothing else works properly. That clamp is your pelvic floor. And the reason most men never address it is simple. Nobody tells them it exists. You have probably been told to do Kegel exercises. Squeeze and hold. Squeeze and hold. Here is the counterintuitive truth. And I want you to really hear this, because it contradicts almost everything you have read online. For many men with BPH and nighttime urination problems, Kegel exercises make things worse. Kegels are a strengthening exercise. They contract the pelvic floor, but if your pelvic floor is already too tight, already clamping down, adding more contraction is like adding more pressure to a muscle that is already in spasm. What you actually need is the opposite. You need to release. You need to lengthen. You need to teach those muscles how to let go. This is the part your doctor may not have had time to explain. Not because they don't care, but because pelvic floor therapy for men is still an underutilized, under-discussed corner of medicine, and the 10-minute appointment doesn't leave room for it. Let me tell you about Raymond. Raymond was 67 years old, a retired postal worker from Ohio. He had been waking up 3, sometimes 4 times every single night for almost 2 years. He was exhausted in a way that went right into his bones. And his doctor had confirmed an enlarged prostate and put him on medication, a common alpha blocker that relaxes the muscles around the prostate. It helped a little, but Raymond was still up twice a night, still dragging himself through the day, still embarrassed to mention it to his adult sons. When Raymond came to me, the first thing I asked him was something no one had asked before. I asked him about his hips. He laughed. He said, "Doc, I came about my bladder." I said, "I know, humor me." His hips were tight. He sat for long hours in his later years, driving routes, desk work after his promotion. His lower back ached most days. When I assessed his pelvic floor, it was a coiled spring, constantly contracted. His body had been holding tension in that region for years without ever releasing it. We didn't change his medication. We didn't add any supplements. We gave Raymond 3 targeted exercises and a simple daily routine. Within 6 weeks, Raymond was waking up once a night, sometimes not at all. His stream improved, his sleep improved, and for the first time in 2 years, he told me he felt like himself again. Raymond's prostate hadn't shrunk. The biology hadn't changed, but the tension that was amplifying every symptom, that invisible clamp, had finally begun to release. What I'm going to give you now is the same approach I gave Raymond. Before I show you exactly what to do, the 3 exercises, step by step, I have one quick request. If this video is giving you information you have never heard before, if you feel like someone is finally being honest with you about what is actually happening in your body, please hit that subscribe button right now and share this video with a man you know who is struggling with this. Your brother, your neighbor, your son-in-law, the man at your church who looks tired every Sunday morning. One click from you could genuinely change someone's health and their sleep and their dignity. I'll be right here. Now, let's get into the exercises. These 3 exercises are not intense. You do not need a gym. You do not need equipment. You need a mat, a floor, and about 10 minutes. The goal of each one is release, not contraction, not strengthening. We are teaching your pelvic floor to let go. Exercise 1, deep diaphragmatic breathing with pelvic floor release. This first exercise sounds almost too simple. I promise you it is not. Most men breathe from their chest. Short, shallow breaths that barely move the belly. This pattern, especially in men who have been under stress for years, keeps the pelvic floor in a constant state of low-level tension. The 2 systems are connected. Your breath and your pelvic floor move together like a piston in an engine. When you breathe correctly, your pelvic floor naturally rises and falls with each breath cycle. When your breathing is shallow and tight, that piston gets stuck. Here's how to do it. Lie on your back on a comfortable surface. Bend your knees so your feet are flat on the floor, about hip width apart. Place one hand on your chest and one hand on your belly. Take a slow breath in through your nose. Your goal is to make the hand on your belly rise while the hand on your chest stays as still as possible. Let your belly expand fully, forward, sideways, even down toward the floor if you can feel it. As you do this, consciously think about releasing the muscles between your sitting bones. Do not tighten anything down there. Let it go. Hold that breath gently for just 2 seconds, and then slowly exhale through pursed lips, like you are blowing out a candle across the room. Let the belly fall. Let everything soften. Do this for 10 breath cycles. That is approximately 2 minutes. Many men tell me they feel a warmth or a loosening sensation in their lower pelvis within the first few breaths. That is the tension beginning to release. That is exactly what we want. Do this exercise every morning before you get out of bed and every night before you go to sleep. The nighttime practice is especially important. You are signaling to your nervous system that it is safe to relax before sleep, and that changes the quality and frequency of your nighttime bathroom trips more than almost anything else. Exercise 2, the supported deep squat with pelvic floor lengthening. Stay with me here. I know the word squat makes men over 60 nervous. This version is gentle. supported, and one of the most effective pelvic floor releases in existence. This position, a deep resting squat, is the natural human elimination posture. It is the position every human body was designed for, and most Western men haven't been in it since childhood. When you are in a deep squat, gravity naturally lengthens and opens the pelvic floor. The muscles that are chronically gripping around the prostate and bladder are physically stretched. The pressure releases. Here's how to do it safely. I stand in front of a sturdy piece of furniture, a heavy chair, a stair railing, or a door frame. Hold on with both hands. Feet should be slightly wider than shoulder width. Toes pointed out at about 45 degrees. Slowly lower yourself down into a squat, holding onto the support the entire time. Go only as far as is comfortable. Your heels do not need to touch the floor. Many men need to put a folded towel or a small pillow under each heel to make this comfortable. That is perfectly fine. Once you are in the lowest comfortable position, breathe. Use the diaphragmatic breathing from exercise 1. Inhale and let the pelvic floor release downward. Exhale slowly. Hold the position for 30 seconds to start. Work up to 60 to 90 seconds over several weeks. Use the support to gently rise back up. Move slowly. Do not rush. Do this once in the morning and once in the evening. If you find it difficult at first, start with just 20 seconds and build gradually. The body adapts. Give it time. What Raymond told me after 2 weeks of doing this was that for the first time in years, he felt like he could fully empty his bladder. That sensation of incompleteness, that maddening feeling that there is always something left, began to ease. That is the pelvic floor releasing its grip on the urethra. Exercise 3, the supine hip opener. This is a stretch that targets the piriformis muscle, a deep muscle in the buttock region that, when tight, directly compresses the nerves and blood vessels that supply the pelvic floor. When the piriformis is chronically shortened and tight, which it becomes in men who sit for long hours, men who drive frequently, men who have lived a full and busy life in a chair, it creates a cascade of tension that flows straight into the pelvic region. Releasing this muscle is like loosening a knot in a rope that has been pulling on everything downstream. Here's how to do it. Lie on your back with both knees bent, feet flat on the floor. Cross your right ankle over your left knee, so your right leg makes a figure 4 shape. Flex your right foot gently to protect your knee. Now, either stay here if you already feel a stretch in your right outer hip and buttock, or gently lift your left foot off the floor and draw your left knee toward your chest. Hold behind your left thigh, or use a towel or strap around the thigh if reaching is difficult. You should feel a deep stretch in your right outer hip and buttock. Breathe deeply. With every exhale, allow the stretch to deepen slightly. Do not force it. Let gravity and breath do the work. Hold for 60 seconds on each side. Repeat twice per day. This stretch directly reduces the external compression on the pelvic nerve network. In my clinical experience, men who do this consistently report a noticeable reduction in urgency, that sudden, desperate need to get to the bathroom immediately, within 2 to 3 weeks. Here is how to make this practical, because I know that a routine you actually do is worth 1,000 exercises you read about and forget. Every morning, before you get out of bed, do 10 cycles of the diaphragmatic breathing. 2 minutes. Still lying down. After you get up and move around a little, do the supported deep squat. Hold for 30 to 60 seconds. Breathe through it. In the evening, before bed, do the figure 4 stretch on both sides. 60 seconds each. Then follow it with 10 more cycles of the breathing exercise. Total time, under 15 minutes per day. You do not need to do all of this perfectly on the first night. Start with just the breathing, just that. Tonight, before you go to sleep, lie on your back, breathe into your belly, and consciously let go of the tension in your lower pelvis. That is how healing begins. One small, deliberate act. Give this routine 6 weeks of consistency, not 6 days. 6 weeks. Tissue changes slowly. Nervous system patterns that took years to form take weeks to begin unwinding. Be patient with your body. It is doing its best. While these exercises are the foundation, a few additional habits work in their favor. Timing your fluids wisely makes a real difference. Research suggests that spreading your fluid intake throughout the day, rather than drinking large amounts in the evening, reduces the burden on the bladder overnight. Aim for most of your daily fluids before 6 p.m. This is not about drinking less. It is about drinking smarter. Limiting bladder irritants in the evening hours is also worth considering. Caffeine, in coffee, tea, and some sodas, is a bladder stimulant. So is alcohol. Neither causes BPH, but both can amplify urgency and nighttime waking in men who already have pelvic tension. Reducing them after midday is something many of my patients report makes a meaningful difference. Warmth helps tight muscles release. A warm bath or a heating pad placed over the lower abdomen and pelvic region for 10 to 15 minutes before bed can support the releasing work your exercises have started. And finally, if these exercises are challenging or if your symptoms are severe, please consider asking your doctor for a referral to a men's pelvic floor physiotherapist. They exist. They are trained for exactly this, and the work they do is among the most underutilized and undervalued in men's health today. Your body has been working for you every single day of your life. It carried you through decades, through hard work, long nights, raising families, building things. It has not given up on you. It is not broken. It is holding tension. It was never meant to hold permanently. And now you know how to begin releasing it. The nighttime waking, the weak stream, the feeling of incompleteness. These are not just the price of getting older. They are signals, and signals can be answered. You have the tools now. Use them. If this video helped you, I want to hear from you. Drop a comment right now and tell me, how many times are you getting up at night, and how long has it been going on? I personally read every single comment. Your story might be exactly what another man at 2 a.m. needs to read to know he is not alone. And if you want to keep going, subscribe and stay with me. Because in my next video, I am going to show you the 5 foods that research suggests actively reduce prostate inflammation and may help shrink an enlarged prostate naturally. That video could be the piece that brings everything together. I will see you there. I am Dr. Marcus, and this is Dr. Marcus Med Show. Goodbye.